morning all. Today we have Dr. Sachin Padal with us, who is a consultant urologist, andrologist, and a laparoscopic surgeon practicing at Lifetree Hospital, Hinjawadi. He has more than 21 years of experience. He has completed his MCH from King George Medical University, Lucknow, and is a gold medalist. Currently, Dr. Sachin Patel is practicing in Lifetree Hospital, Hinjawadi, and Lifespring Healthcare, Baner. He is specialized in treating prostate problems, stone surgeries, urinary tract infections, and urogynec problems. As we all know, November is globally recognized as Prostate Cancer Awareness Month. So, we have few questions from Dr. Sachin Patel, who is expert in this field. So let's start with some few questions that will be helpful for our audience. So, sir, my first question is, what is prostate? We just want a small information on what is prostate.
Prostate is a organ in male reproductive system. It's a walnut-shaped organ basically, and it is located just below bladder. The location of the prostate is in front of the rectum. The prostate surrounds a tubular structure called urethra. Urethra helps in passing urine from bladder outside through penis. So, to summarize, prostate is a part of male reproductive system and it's a walnut shaped organ and it contributes a significant proportion to seminal fluid.
Okay. So, the next question is, what are some common diseases, conditions of prostate?
Okay, so mainly in clinical practice we encounter three common conditions of the prostate. The first being prostatitis, that means infection or inflammation of the prostate. It's fairly common in younger individuals, but in elder patients also we can see the incidence of prostatitis as a rising thing. Okay. Another problem which is very common is benign prostatic enlargement. So that is the problem that occurs with age. As age advances, size of the prostate starts increasing. So that is very common issue nowadays. And third, the most important, which for which you are holding this awareness campaign, that is prostate cancer.
Okay.
So you can say prostate cancer is second leading cancer in men in our country. So that significant is the disease burden of this prostate cancer. So these are the three main conditions associated with prostate, pathological conditions associated with prostate. First being prostatitis, that is infection. Second is benign enlargement of the prostate, that means non-cancerous enlargement of the prostate. And third is prostatic cancer.
Okay. And age is also one of the major factors.
Factors for prostatic enlargement, yes.
And sir, my next question is, what is BPH?
So BPH, when we say this term, it's benign prostatic hyperplasia. Actually, the term should be BPE, that is benign prostatic enlargement. Hyperplasia comes when we have a tissue diagnosis, when we send that for a examination and then they report it as a hyperplasia. So, clinical term is benign prostatic enlargement. So, as the word itself suggests, it's a benign growth. That means it's a non-cancerous growth of the prostate. So, that's what is benign prostatic enlargement is.
Okay. And sir, what causes BPH?
See, till now there is no clear-cut evidence of particular factor causing increased incidence of prostatic hyperplasia or enlargement for that matter. But there are several theories put forward. Most common being it's the age. As I said, as the age advances, men tend to have this problem of prostatic enlargement. And second being normal testicular function. So age and normal testicular function, they contribute to this problem of prostatic enlargement.
And sir, what are some of the symptoms which are associated with the BPH?
Yes. So, see, as I said in initial anatomy or the initial discussion about the prostate, prostate is an organ which surrounds urethra. So, urethra is a tube which carries urine from bladder outside through penis. So, as it surrounds urethra and when the size of the prostate enlarges, it compresses that urethra, right? So, it gives rise to some obstructive or voiding symptom. That means patients have difficulty in passing urine. So, they will complain of poor stream. The flow is not good. They will complain of intermittency. That means flow comes, it stops, it again comes. Okay. Then sense of incomplete voiding. Patient goes for urination, he voids, but he feels that his bladder is not completely emptied. Okay. Apart from this, straining. Patient has to strain to pass urine because prostate is obstructing below. Okay. And apart from these symptoms, there are symptoms related to bladder's irritability. See, bladder has to exert force against obstruction below because of the prostate. So, because of the changes in the bladder, there are several symptoms related to bladder irritability. So, they are called storage symptoms. The symptoms being the most important and common symptom in prostatic enlargement is nocturia. That means nocturia means patient has to get up at night more than once. Then urgency. Urgency is difficulty to postpone urination. Once the patient has urge to pass urine, he has to rush to the toilet. So he cannot postpone urination. So that is urgency. And frequency. Frequency meaning every hour patient has to go for urination. So urgency, frequency, nocturia, straining, sense of incomplete voiding, intermittency. So these are the prominent symptoms associated with prostatic enlargement. So any patient above 50 years of age, 60 years of age, they should not ignore these symptoms suggesting most of the patients think that okay, this is probably aging related problem, but it is not. It is actually prostate related issues and which can be addressed in kind of simply by lifestyle modification or medicines. So they should report to their doctor as early as possible when they notice these symptoms.
And this symptoms these symptoms can occur in any age, it's not in age specific.
If we talk about symptoms because of prostatic enlargement, they are common in elderly population.
Okay.
So most of this disease itself starts in the elder population mostly after 60 years of age.
Okay. And sir, what are the most troublesome symptoms of this problem?
So we just discussed about the symptoms that arise because of the prostatic enlargement. But to mention few troublesome symptoms, one of the troublesome symptom I would stress upon is nocturia. That means patient has to get up frequently at night. So he doesn't have that proper sleep. Then the next day becomes very tiring. Okay. Second problem is urgency or frequency. See, whenever patient has to plan some travel or he has to attend some events, there will be constant stress at back of his mind that he will have to rush to the toilet immediately if he feels. What if there is no toilet available? So these are some of the important or troublesome symptoms to the patient. Apart from that, sense of incomplete voiding. That means, as I said, patient feels that he is not able to empty his bladder completely. Over a period of time, if this problem aggravates, patient may land up in urinary retention. That means he may not be able to pass urine at all. So in that situation, we might have to put a catheter and empty the bladder. Okay. So these are some of the troublesome symptoms associated with prostatic enlargement, which may affect the quality of life of the patient.
Okay. And is BPH a sign of cancer?
No. As the name itself suggests, it's benign. Benign means non-cancerous. So benign prostatic enlargement is typically a non-cancerous enlargement of the prostate. Symptoms of prostatic cancer and benign prostatic enlargement, they are similar, they overlap. Okay. So they may coexist. So patients who have benign prostatic enlargement may also have prostatic cancer, but these two are different entities. So we, as a clinician, when a patient comes to us, we make sure to rule out possibility of prostate cancer in every patient visiting with these symptoms associated with prostatic enlargement.
Yeah. And is it a rare condition like BPH happens, or it is very common?
It's very, very common. So you'll be surprised to know patients, so 50% of the main population above age of 50 will have this prostatic enlargement issues. Okay. And 90% of the population above 80 years of age will experience symptoms associated with prostatic enlargement. So it's that the burden is that significant.
Okay. And how is BPH diagnosed?
So as we discussed about the symptoms, so first thing is history. So in history, the symptom that we discussed is the first thing that we assess. Then we have a symptom score that is called as IPSS. So that symptom score helps in assessing the severity of the problem. So whether it is mild, moderate or severe. So IPSS symptom score is the first thing. Then we do a digital rectal examination or per rectal examination because prostate can be felt through rectum. Okay. And the main purpose of doing this test is to rule out or in fact rather than saying rule out, to diagnose whether that prostate has a nodule which may suggest possibility of cancer. Okay, so digital rectal examination. Then comes the uroflowmetry. See, once a patient comes to me and he says, I have certain issues related to flow, some of them may perceive it as an age related problem. And they may not tell, ki, no, I don't have, they may say that I don't have that significant issue. So how do I know exactly what is the kind of flow that patients have? So uroflowmetry is the guide which give me the objective assessment of patient's flow, so that I can assess how critical or how severe the problem related to the flow is. So uroflowmetry is second test. Then ultrasound sonography. So what we see in sonography is the size of the prostate, status of the bladder, whether there are bladder stones can form because of the prostatic enlargement, whether there are changes in the kidney, swelling in the kidneys, and post-void residual urine. So that means how much urine is left after patient passes urine in the bladder. So these are the things that we assess on ultrasound. Urine analysis is not always necessary. It is done whenever patient has complaints of burning while passing urine or foul smelling urine or symptoms suggestive of urine infection, we go for urine analysis. Now, again, if we discuss about prostate cancer, so serum PSA, prostate specific antigen, this is a blood test, which is a kind of screening test that we do in patients with prostatic enlargement or patients having symptoms of prostatic enlargement. Again, it is not compulsory, it is up to the clinical findings, digital rectal examination findings, we advise patients to get a serum PSA done. So these are the commonly done tests to assess a problem of prostatic enlargement, assess its severity and other complications associated with prostatic enlargement.
Okay.
Yeah.
And sir, what are some of the treatments available for BPH?
Again, I'll like to explain here. Most of the patients come to me when they have been diagnosed elsewhere with the prostatic enlargement. They have in their back of mind that surgery is the option for prostatic enlargement because ultrasound is showing the enlarged prostate. Very small subset of patients with prostatic enlargement require surgery.
Okay.
Very small. In fact, many of them do not require even medication. So see, we have 3 treatment options for the treatment of prostatic enlargement. That depends on the IPSS score that we discussed, like whether the symptoms are mild, moderate, severe. Then associated complications with prostatic enlargement. We take these factors into account and decide which form of treatment is best suitable for that patient. Suppose a patient has mild symptoms, okay, we can just advise lifestyle modification as the treatment measure, not even medications are required. So what does lifestyle modification means? So it means keeping body weight under control, exercise, okay, avoiding excessive tea, coffee or alcohol consumption, having less fluid in the evening so that patient need not go for urination frequently at night. So these are the lifestyle modification measures that patient can implement to get improvement without even medications, okay. Some of the patients who have moderate symptoms and bothersome symptoms and affecting quality of life, we give them some medications which relax bladder neck and opens up the passage so that patient has improvement in the flow. Generally, medications given for prostatic enlargement, patient has to take them for life. Okay, as we take medications for hypertension and diabetes, similarly here the patient is supposed to take medication throughout the life. Okay, and as I said, very small subset of patients with prostatic enlargement require surgery. So we have absolute indications which patient should undergo surgery. So just to list few, if the patient has recurrent urinary retention, patient has recurrent urinary infection, recurrent bleeding in urine, that is hematuria, or presence of bladder stones or bladder diverticula, or because of the prostate if the kidneys are enlarged or kidney failure, renal failure is there, this can happen in patients with the prostatic enlargement. All these are the absolute indications for surgery where there is no option of watchful waiting, lifestyle modification or medication. So surgery is the option. So in surgery also we have conventional TURP, which is still a gold standard and commonly performed surgery. Nowadays laser prostate surgeries are being explored more frequently, more often. The advantage being less blood loss and early recovery. So that is all about the treatment of the prostate. Yeah.
So, like a basic change in a lifestyle can help a person in
Yes,
treating this
yes,
problem.
especially when the patient has mild symptoms. Like simple lifestyle modification is enough for them.
Right.
Yes, yes.
So thank you so much, sir, for
Thank
all
you.
the insightful informations.
Thank you.
I hope this is useful for everyone.
Thank you
And
very
it was
much.
really nice talking to you, sir.
Thank you so much.
Thank
Thank
you.
you.